now that we've explained what an apnea is from a definition standpoint, I want to share with you the life of an apnea. I know that may sound a little weird, but just go with me for a second. See, you're breathing at night. Before an apneic episode happens, you're laying on your side or your back, and your respiratory cycle is much lower and quicker. It's almost like a hyperventilation, but softer. You see, when we go to sleep, our bodies relax. We don't take the same level of deep breaths as we normally do during the day. What we actually do is more of and it's very relaxing to our bodies. It's more of a rhythmic type of a respiratory cycle. And in the middle of that calm, relaxing cycle, the airway collapses. And as it does, the brain knows in the split second that occurs that apnea has occurred, the breathing pattern has stopped, and it starts to implement safety protocols. So the oxygen starts to drop, and the brain is sending signals saying, open the airway, open the airway. What do we need to do? Open the airway. Heart, start pumping faster. And it makes your heart go faster. You start moving blood throughout your body much quicker. Boom, 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 boom. Trying to get oxygen to the rest of your vital organs. And when that doesn't work, your heart will still continue beating, and your brain activates the masseter and temporalis muscles in many patients. So these muscles here are responsible for clenching. We would clench down, grind our teeth, and start to move our jaw forward. All of this while we're still asleep. Meanwhile, the brain is in its safety protocol measures going down the list, trying to make sure that we survive. Because if we go too long without oxygen, any one of us would die. So the brain is going down the list. These muscles are now moving. Our teeth are grinding. Our tongue is shoving forward, but it's still not working. So what does it do? It starts releasing cortisol, the stress hormone you've probably heard of that makes us gain weight. It will start releasing cortisol in the body, speeding up the heart rate and eventually causing the brain to wake up from its sleep state. Waking up out of sleep is the brain's last resort to stop apnea and open the airway again. So it starts off as an apneic episode only being 10 seconds. That's the minimum criteria that we talked about in the last video. But you can see over time, as the bodies become desensitized to these apnea episodes that keep occurring night after night, week after week, year after year, the body's system becomes desensitized and frankly, wanting more sleep in those moments than it cares for oxygen. It's trading oxygen for sleep 1 second at a time, in some cases, minutes in length for these apneas. So apnea being a progressive disease means that whenever you get tested or screened, that is likely the best picture that you'll ever have of how you sleep and what your apnea looks like. And over time, as our muscles get flaccid, meaning they relax and they lose their tone, then our bodies, as we age, will get more relaxed and tend to have more apnea. So we don't want to have a cycle that the apnea gets longer and longer, causing the brain more and more and more stress over time. What we want is to impact that and change that apneic episode from happening. We want to keep an open airway, oxygen flowing, and that calm, peaceful, restful respiratory rate throughout the night. So when you think about laying down, taking a deep breath and relaxing as you're breathing normally and going to bed, that's what our body wants to do. And if we're breaking that up throughout the night with these apneic crisis episodes, it makes sense why we're tired.